17 is covering the immunity, and this is one of the most important processes that happens in our body, and it's part of the defense system. The defense system, and especially that is ensured by the immunity, protects us against any type of harmful agent that may enter the body. And probably the most common example that you will have is an infection organisms. Um, in addition to that, this system may protect us against any type of abnormal cells that may arise at a certain point within the body, such as tumor cells. In other words, they are essential. It's an essential part. It's an essential system that it's critical for protection against cancer or any type of invasions of microorganisms or any other toxic elements from the outside. Please follow the overview for this lecture. Um, we'll explain why do infections occur in terms of defining pathogen factors and host associated factors that um, contribute to the development of an infection. We'll discuss innate immunity, including barriers, cells and chemicals. We'll discuss the adaptive immunity with its aspects regarding the T cells, B cells, and different types of immunity. We'll also look into immune disorders as they pertain to allergy, autoimmunity, immune deficiency conditions, and multiple myeloma. We'll look into the role of the immune system and cancer and transplantation and rejection. Please stop this presentation and take a moment to review the learning objectives. Our body is constantly exposed to pathogens, to antigens, to all those elements that may harm our body systems from the outside environment. The system in charge of protecting us is the immune system, and it's made out of a system of cells and tissues that are able to fight against those antigens. Um, Before we are going to explore and understand the immune system, I will need to define a few elements. Our body is exposed and in touch with the external environment through several portals of entries. And different pathogens may have different portals of entries, ways to reach our body, our inside. So the portal of entry represents an important element that may influence the development or the severity of an infection. The most common entrance for the pathogens is the respiratory tract. In addition to that, the second most common will be the digestive system. And in addition, the next one will be the urinary and reproductive system. If you look into that, all those systems that I was telling you about have areas that are exposed to the outside environment. To add to those four systems, we can add the integumentary system that is the largest and the most important barrier and protection level that we have against pathogens. However, if there is any break in the skin, or for what that matter, into a mucous membranes in other systems, that may allow microorganisms to easily access deeper tissues and develop into an infection. So this is one element that we need to understand and look into when we discuss infections, the portal of entry, how a microorganism is reaching the inside of our body. Another element that is essential for understanding infections and the development of them is what we call the virulence of an organism, or the power of that organism to overcome the host defense. So we have two elements in here. We have what is called aggressiveness, and that's the power of invasion that the microorganism may have. And the second aspect in the virulence is their ability to produce, not all of them can do that, only some of them are able to produce that, to produce a toxin, which needs to be seen as a poison that can damage locally the structures or can damage systemically, can travel through blood and invade and produce damage far away from the local, for the level from the place where the infection started. So different species, different bacteria, and different viruses have a different type of virulence. Um, and even different strains may have different types of virulence. And we are seeing this nowadays with the COVID-19 infections, how the virulence of the organism manifests in different ways. Now, because we are quite in the deep of this pandemic, we know and we kind of are able to identify how the East Coast has a different type of COVID than we have on the West Coast. While the East Coast seems to have the origin in Europe, the West Coast seems to really have the origin back in the original place where it started in China. The dose is also another element that is essential. The number of pathogens, the more they are, the more likely they will be to develop into a disease and invade the body. And that depends also in their aggressiveness. The more they are more aggressive, the more severe the condition will be. And finally, we'll have the individual condition or their predisposition of developing an infection, their ability of their immune system to overcome or not overcome an infection. And in this individual condition, we can again relate back to the COVID and express the fact that there are individuals that they are carriers, they are carrying the virus currently, and they have no signs and symptoms, as opposed to other people that have contracted the virus and they are in severe condition right now. When we are looking at the immune response and how we defend our body against pathogens, try and see it as a war zone. And just like when you are playing those computer games where you need to lead your your troops and win a certain battle, you have certain lines of defense. Um, we call them defense, but in a way, we call them defense because we are not attacking the bacteria. We're attacking only the bacteria that is trying to invade our body. That's why we're calling them defense, but it can be seen as an aggressive and offensive way of the body taking care of their own territory. So when we're looking at those lines, and they are very well organized, we can classify them as innate or adaptive. So, and we'll discuss each of those separate. The innate are those defense mechanisms that we are born with, and they are inherited from our parents. So those barriers may include certain cellular and metabolic responses that protect us against any type of harmful substance or pathogen from the outside. They are usually very rapid, and they're relatively non-specific because they protect us against any type of um, attack, and can help either prevent or slow an infection. The adaptive defenses, and we'll describe that in more detail later, develop after we are exposed to a particular pathogen, and they are very specific to that one. Those adaptive defenses are a little bit slower to develop. However, once well developed, they will completely eliminate that specific pathogen once encountered again in future infections. We'll discuss now the first line of the innate barriers, because the innate barriers have more than one level, and we'll start with the basic one. Look at the base of this image on the right side of your screen, and you see the pathogen, and the first one will be obviously a physical one, and that's the skin, the mucous membranes, and in association with that, you'll see body secretion and reflexes. So the skin is the mechanical barrier as long as it stays intact and is not injured. Any type of injury to the skin that is serious as a burn or a laceration that is big enough may result in the skin destruction and in inability of this barrier to perform. The mucous membranes, similar to the skin, will line all those passageways that will lead inside our bodies, and they will also act as a barrier, trying to keep away the foreign material. And they do that mainly because all the cavities that we have, and they are lined by mucosa, will have some type of secretion, most of the time this being sticky. In addition to that, a lot of the membranes in those cavities will have the cilia that are sweeping out all the particles, are catching it and sweeping it out. Cilia is especially present at the level of the upper respiratory tract. In addition to those two elements, we have body secretions, and those will be the tears and saliva and perspiration, and those contain enzymes that can not only, they are fluid, they are washing away the microorganism, and in addition, they contain all kinds of enzymes that are acidic and will destroy those pathogens. We can add to it the digestive juices that are starting at the stomach level. The pH is very low, is 1, will destroy most of the ingested bacteria, or their toxin will be inactivated. Also in the first line, we have what is called certain reflexes that are used by the body as a protection in its way of removing pathogens. And we put in this the sneezing and coughing that are removing all type of foreign materials, and the foreign material with the secretions that are engulfed inside those secretions will be eliminated on the outside of the upper respiratory tract. Also in the body reflexing, it's a stretch, but we can put in this the vomiting and the diarrhea, by which any type of ingested toxin or bacteria will be quickly eliminated from the digestive tract in order to protect and limit their action on our body. We will look now at the second line of the innate immunity. Let's say that the pathogen was able to progress through the first line of defense. Now it will encounter a second line that is defined by a number of internal activities that the body is able to defend itself against pathogens. And as I said before, they are non-specific. They will be activated no matter what type of pathogen will be involved. And in this process, recently, there are some innate immune cells that were discovered and described, and they possess a specific type of receptors. They are called toll-like receptors, toll meaning great in German. And those toll-like receptors are able to recognize pathogens, to bind to them, and as a result of that, those pathogens become obvious to the body, and the body can recognize them as non-self and can attack them and remove them. Another process involved in the second line of defense is the process of phagocytosis, when the white blood cells will engulf and take in and destroy all those particles that are not they're not providing any kind of benefit to our body. And in this category of non-benefiting particles, beside the waste that the body-owned metabolism will create, we have also the pathogens and the cancer cells. Involved in this process of phagocytosis, we have the neutrophils, which are the granular leukocytes, and those are the most important category of cells. And also we have the macrophage, that are those large white cells that are transformed monocytes, that are the agranular leukocytes. If you remember, the macrophage is developed from a monocyte that migrate inside peripheral tissues outside the blood vessels. There are also, in some of our organs, will have a specific type of macrophage that are called Kupffer cells, and they are present in the liver. And if you remember, I was telling you that the liver is one of the filters for our body because it filters, when I was describing the portal system, it filters, is the first filter that will get the blood flow with the absorbed substances from the small bowel. So let's say there was an injury and some pathogens are able to overcome that level, and they are not destroyed by the gastric juices and all the rest of the juices, and they too found their way inside the blood flow. The macrophage at the level of the liver have the chance to get them in time and destroy. And the third type of element that is involved in the second line is called the natural killer or NK cells. This is a very special type of lymphocyte that is different from those that will be active in the other type of immunity, in the adaptive type of immunity. Those natural killer cells possess those toll-like receptors and also other receptors that can detect antigen patterns that can be in the pathogen or in cancerous cells, and as a result of that, they will come in contact with those abnormal cells and they will destroy them. They are exactly like the name says, natural killers, and they are found in specific types of tissue in our body. Beside the blood and the bone marrow where they develop, they can be found in lymph nodes and spleen. In order for the body to be able to produce this type of innate response, inborn response to aggressors from outside, it will need a communication, a way to have all those systems, all those lines of defense coordinated. And in order to do that, the body is using what is called chemical mediators. Those are some substances that will be secreted and eliminated in the blood flow in our body that will transfer signals and will coordinate between the barrier systems, the lines of defense. And this slide is summarizing the most important categories of chemicals involved in the innate immunity. We call them cytokines, and those are peptides that are produced by immune cells or some other body cells in order to transfer a signal and becoming what is called a cell activators. Most of those cytokines will modulate an immune response. And when I say modulate, is exacerbating it or decreasing it. That's when a substance is modulating. We'll have interleukins and interferons, as well as the complement system, which is a whole group of proteins. And they will be activated when there is tissue damage or by the presence of pathogens. So when we are looking at the interleukins, those will be will be produced by the activated macrophage and other immune cells. And as a result of their activation, they will promote inflammation and fever. That as a result of that, they will attract more macrophage and immune cells. It's kind of putting the fire over there to let everyone know that there is a problem in a certain area. We'll also have, we'll discuss interferon and complement in a second a little bit more in detail. So I'm jumping over the interferon. I'm going into the histamines. Histamine is another chemical that is released from the mast cells. Mast cells will throw it out there, and as a response of that, the histamine will dilate the arterioles and will increase capillary leakiness. When I say leakiness, it means that will increase the pores in between the cells of the capillaries, allowing for the white blood cells to have a way to escape and go inside the tissue. As a result of this action, we'll have an increase in redness and the swelling, because with the leakiness of the capillaries, not just the elements can go out through it inside the interstitial part of our body, but also the fluids will move with them. Another particle will be the prostaglandins that are secreted by and produced by the mast cells, neutrophils. They have similar effects as the histamine, And in addition to dilating arterioles and increasing the capillary leakiness, they will also activate pain receptors and will alert the body there is a problem in a certain part of it. We'll discuss now the interferon. And interferon, it's a special type of substance that was first found in a cell infected by an influenza virus. And it was named interferon because it was interfering, was bothering the multiplication and the spread of the virus. In other words, sometimes when a cell will be infected by a virus, the cell itself will start producing a substance that will try to limit and prevent nearby cells from producing more viruses. So the interferon is known to be a group of substances, it's not just one. The abbreviation for it will be INF and followed by a Greek letter. It can be either alpha or beta in terms of differentiating between different categories. We can produce now interferon by genetic engineering, and we can use it as a medical therapy. It's used in certain viral infection as a treatment, as for hepatitis. Also, it has a non-specifically action on cells by kind of boosting boosting the immune system. So it has been used with quite a good success in treatment of malignancies such as melanoma, leukemia, Kaposi sarcoma, and that Kaposi sarcoma is a cancer associated with AIDS. And also, the type B was found to be helpful in treating an autoimmune disorder that is multiple sclerosis. The complement is a group of proteins, and they are called nonspecific because they can be activated and can perform this type of cleaning crew type of activity, regardless if it's a type of the pathogen or if it's a waste product. Those proteins will always be present in the blood, and they are traveling throughout our body at any given moment in an inactive type of form. In order to become activated, they need to come in contact with a foreign cell surface or with some specific immune complexes. So complement, it's named like this because it complements, it helps, it assists in the immune response. And it assists and it helps in the immune response by doing the following actions. It will bind to any kind of foreign cell, and by doing that, will send a signal to phagocytes to come and destroy them. It will destroy even cells by forming what is called channels, called membrane attack complexes. What they are doing, they are putting tiny holes, like kind of perforating the membrane of the pathogen. And as a result of perforating their membrane, the water from the body will enter the pathogen and will make it explode. Will promote inflammation by increasing capillary permeability. And just like I was telling you before about the histamine and prostaglandin, they will increase the capillary leakiness, will increase the spaces in between the cells, allowing the white blood cells to leak out and provide a function in the tissues. And will also attract cells that have the ability to eat other particles, the phagocytes, to an area of inflammation. We'll need now to understand and define what is an inflammatory reaction and what happens during an inflammation. An inflammation is a non-specific defensive response to any type of tissue damage. It can happen as a result of friction or X-ray, exposure to X-ray, exposure to extreme temperature, exposure to any type of chemicals or allergens. It can be the result also of what is called the irritation of an infection. And once a pathogen enters the body, you kind of understand by now that it will be a cascade of defensive processes that will start and will snowball out of that. In an inflammatory reaction, we have usually 4 classic symptoms, and whenever we have those, we can say we have an inflammation. Please pay attention and do not put an equal sign between inflammation and infection. An infection is a particular case of inflammation. Every infection will be an inflammation. However, not all the inflammations are infections also. So we have 4 classic symptoms. We'll have the heat, the redness, the swelling, and the pain. And the inflammatory reaction, regardless what is causing it, because it's so non-specific, will go through the same stages. It has to follow the same stages because the same cascade of events will happen in every single time that an inflammatory reaction will start. Any type of tissue injury or a pathogen that enters the body will activate the mast cells. Mast cells, if you remember, they are the big cells that live inside the tissues and they are part of the immune system. Those activated mast cells will release histamine. And as a result of increased quantities of histamine in the tissues, the local blood vessels will dilate and will become leaky. I was telling you that their pores will, and you can, what I'm telling you now, you can kind of follow on the image and find those elements that I'm talking about. So the blood vessels will dilate, will become leaky, and will allow the migration of neutrophils from the bloodstream to the tissues. So the blood plasma will also leak along outside the vessels and will begin to clot around the area where the invasion happens. And this is a way of trying to limit the spread of the infection to other areas. The increased blood flows from vasodilation will cause that local heat and redness. The pathogen also, or the injury, will also activate any type of resident immune cells. And when I say resident, any type of immune cells that are in that area. And as a result of that, the immune cells will release cytokines and other inflammatory chemicals. And those chemicals will attract new leukocytes to the area, will find the signal out there to other soldiers to come and help in the process. And those leukocytes that will be attracted into the fight will be neutrophils and monocytes that once in the tissues will become the macrophage. So those cells, the neutrophils and the phagocytes, the macrophage, will work together in terms of removing and cleaning out the tissues from the pathogens and any other damaged cells of the host that were damaged in the process. As a result of this activity, there will be a mixture of leukocytes and fluid, and the fluid will be this inflammatory exudate that will increase the swelling and will put pressure on nerve endings that are present at the level of that tissue. And as a result of that, the host will feel the pain, and the host will be alerted there's something wrong in that area. The immune-activated cells will secrete those chemicals that I was talking before about them, prostaglandins and histamines and cytokines, and those will increase even more this pain and the inflammation locally. When the phagocytes are destroyed in large number while they work in the area, they will die along with the tissue cells in that place, in that area, and that mixture of the fluid, that is the inflammatory fluid, the exudate, the living and dead white blood cells and pathogens and destroyed tissue cells is what we call pus. If you remember from your lymphatic system, I was telling you that the system that is trying to counterbalance every time that the fluids are leaking inside the um, um, interstitial space, this is the lymphatic system. And lymphatic system will try to overcome the amount of fluid that accumulated in the inflamed area and will carry it towards the lymph node. Now, the lymph nodes will be the filters that will try and drain and clean out even more those pathogens that were removed from the area in the infection. And as a result of this overwork of the lymphatic system, there will be an enlargement of the lymph nodes. And the process is called lymphadenitis. So whenever we have a lymphadenitis, we know that there is infection somewhere and that those lymph nodes are working overtime to produce more cells to fight the infection. Now, the inflammatory reaction in terms of the events that happen. Once there is a tissue injury or the tissues are exposed to the presence of a pathogen, there are two chains of reactions. One will be the activation of the mast cells that, as a result of that, will release the histamine, and under the influence of the increased level of histamine, the blood vessels will widen and will become leaky. As a result of the leakiness of the capillaries, there will be an increased blood flow with plasma leaking to the tissues. And in terms of clinical aspects, what we will see on the outside when we examine the patient, we'll see the redness, the swelling, the heat, and the pain. The other chain of events that start with a tissue injury or the presence of the pathogen will be the activation of the resident immune cells. And those resident immune cells will will start to release cytokines. And the cytokines will attract and activate other immune cells. And in addition, they will activate pain receptors. So there will be pain felt by the patient at the level of the inflammatory response. In terms of clinical image, we'll see again redness, swelling, and heat in addition to the pain. As a result of the activation and attraction of other immune cells under the cytokine presence, the immune cells will start destroying the pathogens or the damaged cells. And whenever this response is increased, there will be, as a result, we'll see the formation of pus. Another element that participates and it's part of the innate immunity is the process of producing fever. And the red link up there is taking you to a different movie that can help you understand the concept from a different point of view. So if you remember, we were discussing in the first and second chapter, we were discussing the homeostasis of the body temperature and how narrow range the thermostat that we have in our brain keeps the set point for the temperature, and that's done through what is called a negative feedback. However, whenever the phagocytes are exposed to infecting organisms, they will release all those substances that will raise the set point, will raise the thermostat, and as a result of that, the body temperature will increase. The action of the substances released by the phagocytes will produce a change at the level of the brain. And this increase is called fever. And the fever, the main reason for having the fever is because the fever is boosting the immune system. Under an increased temperature, the phagocytes will have an increased activity, will be stimulated. The metabolism will be increased for the whole body, and the pathogen, most of the time, will be decreased. The multiplication of the pathogen will be decreased because their metabolism will be impaired. So there is this type of common misconception that a fever is dangerous and therefore it should be quickly eliminated. Now, if we control or not the fever, that will do very little in the course of an illness. However, we will treat fever whenever this develops extremely on a very quick time frame. And also, we do observe, and fever is part of the vital signs because the fever may signal, the fever development may signal that there is a presence of a serious disorder, or there is an increased metabolic rate that may have adverse effects on the patient's outcome. Which of the following is not a classic symptom of inflammation? A. Redness, B. Swelling, C. Heat, or D. Cyanosis. Redness, swelling, and heat are classic symptoms of inflammation, while cyanosis is not considered a sign or symptom of inflammation. Well, we'll start to explore now the second type of immunity, which is the adaptive immunity. It can be also considered the final line of defense. And this is also acquired, it's developed during our life. And it can be defined as that individual power to overcome or to repel or to resist to a particular disease or to a particular harmful process. Adaptive immunity is a selective process. Being immune to one disease doesn't mean that you're immune to any others. Therefore, it's called specific. It has a specificity. When I said that it's called acquired, it's because, again, it develops during a lifetime while the person is exposed to different harmful agents. The process of developing acquired immunity starts with the presence of a particular type of foreign substance. And we call those foreign substances that are able to induce an immune response in our body, we call them antigens. And the body will create in response to that an antibody. An antibody production will be generated by the presence of an antigen. Most of those antigens will be large proteins, but also can be carbohydrates, and even some lipids may act as an antigen. Everything that is normally a non-self antigen, something that the body doesn't recognize as belonging to itself, will generate an immune response. This type of antigens can be found on the surface of pathogenic organism, other tissues that are transplanted tissue or transfused cells, in some cancer cells that they are losing their ability of being perceived as self. Some other antigens can be found in pollens, in toxins, or in food. As a response to the presence of those antigens, two types of cells will be activated, and those will be lymphocytes type C and B, T and B cells. There are two types of cells involved in the adaptive immunity. Those are T cells, T lymphocytes, and B lymphocytes. Both of those cells will start being developed by the hematopoietic stem cells in the bone marrow. However, those lymphocytes will have different pathways of development, and also they have different types of action in the immune system. Once developed, but still immature, they will migrate, and the T cells will migrate to the thymus, and they are actually up to 80% of the lymphocytes that we can find in our circulating blood, while the B cells will migrate to the lymph nodes. We'll discuss them in a second. So in the thymus, those T lymphocytes will start multiplying, and they gain the ability to combine with specific foreign antigens. And they become, by doing that, they become sensitized to specific antigens. So they are kind of trained soldiers to identify a specific type of antigen and respond the moment that the body will encounter that pathogen again. So those cells that are thymus derived, because they mature in the thymus, will be part of the cell-mediated immunity. And we have a few types of those. We have the cytotoxic T cells that are able to destroy certain abnormal cells directly. They don't need anything else but themselves. They will recognize an infected cell infected by a virus, let's say, or a cancer cell or some foreign antigens that are present in transplant tissues, and they will produce substances that will cause what is will determine in that cell what is called a self-destruction or programmed death of the cell. It's called apoptosis. Just by the being in the presence of those substances that the cytotoxic T cells are producing, the affected cell will kind of self-destruct, will commit suicide, if you want. We have the helper T cells, and those will control immune responses by releasing interleukins. And those are signaling molecules that will actually signaling and produce. This diagram is presenting to you the activation of the T cells. The dendritic cells will recognize the foreign antigen and will engulf it. And with the use of the lysosome and their enzymes, they will completely destroy the bacteria or the foreign antigen and transform it in microparticles. Those microparticles will be exposed on the outside of the dendritic cell, will be presented to other cells on the surface, and the T cells will recognize those tiny fragments, and as a result of connecting to them in a lock and key type of mechanism, the T cells will become activated and will release on the outside the cytokines. The second type of cells that are involved in the immune response will be the B cells or the B lymphocytes. And they are called B as opposed to the T lymphocytes that mature in the thymus because they mature in the red bone marrow. Once matured in the red bone marrow, therefore the B cells will produce Y-shaped proteins, and those proteins are called antibodies or immunoglobulins. And those immunoglobulins will be specifically produced in response to a certain type of foreign antigen. So just like the T cells, the B cells will have some surface receptors that will be able to recognize and bind specifically to a certain type of antigen. Once the exposure to the antigen happens, that will stimulate the cell to rapidly multiply and will produce a large numbers or clones of plasma cells. Those mature cells will produce the antibodies that will target specifically the original antigen. Those will be released into the bloodstream and will provide the form of immunity that we describe as the humoral immunity. Back in the day, the fluids of the body were called humors. So in this case, you understand how the humoral immunity is actually a long-term type of immunity and protects in general against circulated antigens or bacteria that can be present outside of the cells. All those antibodies are contained in a portion of the blood plasma that is called the gamma globulin fraction. We can identify and isolate them, and it's important to know that because that's a way that we can both isolate them, extract them, and use them from one patient to the other, and also to identify and say that a patient was exposed to a certain antigen just by identifying the specific antibody for that antigen. That's pretty much what they are trying to do now in the to prove the herd immunity in California against the COVID-19. And this slide again will summarize the B cell activation, and you can see how an original B cell that has a B cell receptor will specifically bind the type of pathogen that with a lock and key type of mechanism is able to bind to it. And as a result of that, this cell becomes activated, will increase extremely, and will start a mitosis process. And as a result of that, we'll have 4 cells. 3 of them will be huge plasma cells that are able to release antibodies that are specifically produced against this pathogen. And the last one will be a memory B cell that will be kind of saved in the memory of the organism. So the moment that that memory cell later in life will encounter again the same pathogen, will be exposed to the same type of bacteria or antigen, whatever that is. This time the mitosis is extremely more powerful, and you can see that from one cell, instead of having just 4 cells, now we have 8 cells, and out of those 8 cells, 6 of them will produce antibodies. So you see that how at the secondary time that you're exposed to the antigen, the plasma cells will produce even more antibodies. And instead of having just 1 memory cell, now we have a result of 2 memory cells. So if you look at this, you can understand how when I'm vaccinating someone, I'm producing the first 2 steps. When I'm giving a booster, the booster is the second encounter with the same antigen, and you can see how the response to boosters are so much more powerful and stronger. And that kind of explains to you the need and the reasoning behind giving a booster. So we'll discuss a little bit the roles of antibodies. So again, they are produced in response to a specific antigen, and that usually will be a bacterial protein or a toxin. And they are manufactured by the plasma cell in a certain type of shape that matches perfectly, like a lock and key type of mechanism, that part of antigen. Some antibodies can bind only to the antigen that caused them, and the antibodies will not want to destroy the cell directly. However, they do assist in the immune response. As an example, they will prevent the pathogen from attaching to another cell. They will help with phagocytosis by being so big the body cells will recognize the pathogen, will activate natural killer cells, or can, by binding on them, can actually neutralize toxins. In addition to that, the antigen-antibody forms a complex, and this complex will activate the complement system. Do you remember that complement system made out of a multitude of substances that are contributing to the immune system? And this complement system, if you remember, is the innate, the non-specific type of immunity. So now the specific type of immunity is activating my non-specific mechanisms for protection. So we'll discuss now the mechanism of antibody production. And if you see in this graph, we have 2 types of antibodies. We have the first type of antibodies, IgM. Those are big molecules, will start to be produced immediately when the body will encounter a new pathogen. Even at the second exposure, they will be produced. However, they start to increase immediately, but they do not have a big response. You see that the hip of this graph, it's in red in your image, is not very, very high in terms of titers of levels. A little bit later, a few days later, we'll have a different types of immunoglobulin, which is the more permanent one. It's a smaller type of immunoglobulin, however, more resistant and more efficient, that starts to grow as a level in the bloodstream a few days later. By 14 days after the primary response to the first exposure, you see that the immunoglobulin M will completely disappear, will not going to be in the blood anymore. However, we still have a certain titer of IgG, of the more permanent one, and both of them will hit to the first exposure not very high. Let's pretend that now, a month later, we'll have a second exposure, let's say through a booster, a vaccination to the same antigen. And you can see how IgM will grow up again. However, only a little bit. The hip it's shorter. If you look at it, you can see that hip's quicker. So it has an increase in levels a little bit sooner than the second one. However, it's not by a lot higher than the previous first exposure. If you look at the IgG, you see how extreme the secondary response is and how more permanent. At the second exposure, you see how the level of remaining antibodies in the bloodstream is way higher than it was the first time. So you can imagine that the third and fourth exposure will increase this level of antibodies even more than that. Which of the following is not a type of T cells? A, helper cells, B, plasma cells, C, cytotoxic cells, or D, memory cells? Plasma cells are not a type of T cells. Helper cells, cytotoxic cells, and memory cells, they are all types of T cells. We'll discuss now types of immunity, and if you will click on the red link, you can see that that takes you to another movie that is very informative in terms of adaptive immunity. So the adaptive immunity, we already defined it as a type of immunity that develops in time, and it's not something that we are born with. So the infection is the point, or the interaction with the antigen is that thing that would trigger the immunity. And the infection may be very mild as to cause no symptoms. It's called subclinical. However, it will stimulate the host immune response. At the point that the person will be invaded by enough, at an increased number of microorganisms, that infection may become clinically active. So we have, just by thinking about how we can acquire this artificial immunity, we have 4 types of it. And if you look into that, you see that we have a natural type. And that is without the involvement of a health professional. It means that I'm not vaccinated against the flu. I will get in touch with that germ this season. I will do the disease, and as a result of that, I will become sick. And as a result of that, I will gain immunity against the flu, definitely just against the flu for this season, for this strain. We have also a type of immunity that is called artificial. And it's called artificial because it involves the presence of a health professional. It will be given to me in an artificial way. And if we're spreading those two into 2 categories, that the natural and artificial immunity can be active, result of the activation of the immune response inside my body, or passive, just by having antibodies passed to me in an artificial way while my immune system is not doing the work. So for the natural immunity, the active way of gaining it, it will be by exposing myself to flu, while the passive way of gaining natural immunity will be by receiving antibodies through the placenta or through the breast milk from the mother. That's natural because there is no healthcare professional involved in that. In the artificial type, the active type will be to receive a vaccination that will activate my immune system through an antigen that is artificially inoculated to me, while the passive type of immunity will be when I am inoculated with a serum, with the antibodies that are extracted from the body of another person that produced them against the same antigen. So from this point of view, we have different types of vaccines. We have live viruses or attenuated viruses, and now we are talking about that type of active artificial type of immunity. We can provide toxoid, which is a toxin that is treated and inactivated partially by heat or chemicals. So we're not going to fully produce all the signs and symptoms of the toxoid in our body. However, it will stimulate my immune system to recognize it in the future and inactivate it. And also we may have, like in the case of hepatitis B vaccination, we have a purified or a genetically engineered antigenic component. In hepatitis B case, the virus is so dangerous and so virulent that we cannot give it life, and we cannot give it attenuated to any kind of patients because we are afraid that they will have the disease. However, we are able to recognize in the outside envelope of the virus some particles that we are able to recreate them in a lab and inoculate them. And those particles will be recognized as non-self by my immune system, and I will develop antibodies against them. So in terms of modes of administration, we can transfer we can do the vaccination through injections, IM. Some of the vaccination are oral vaccination, like back in the day, it was the polio vaccination was an oral one, or we can have intranasal sprays. Boosters. So in many cases, the active immunity that is acquired by an artificial and sometimes even in natural cases will not going to last a lifetime. And over time, as you've seen in that graph, the circulating antibodies may decline. In order to maintain a necessary, as high as possible, titer of antibodies in the blood, we need to repeat the inoculation, and those will be called booster shots. There are schedules for different types of vaccination, and especially in the situation of epidemics in high schools or colleges, there may show up prompt recommendation for a certain specific boosters. This slide presents you some of the most common types of vaccines that we are using. DTaP is covering diphtheria, tetanus, and pertussis, which is the whooping cough. The Hib will cover the Haemophilus influenza type B. The meningococcal vaccine will cover meningococcus that is causing the meningococcal meningitis. PCV is covering, and it's a vaccination against pneumococcus pneumonia or meningitis. And we have some vaccinations that are protecting against viral pathogens, as is the HPV that protects against the human papillomavirus that is causing reproductive cancers, cervical cancer in female and penile cancer in male. Influenza that protects against the seasonal influenza, the flu. Remember that the flu is a vaccination that needs to be repeated every year, and not because we are losing our immunity, but because the flu is changing its characteristics. It's an adaptation of the virus, and they will every year will have a different strain of influenza. MMR, which is the measles, mumps, rubella combination of vaccine in this one vaccine. Rotavirus protects against the gastroenteritis virus, varicella for chickenpox, and zoster VZV vaccination that protects against shingles. Antiserum. The active immunity, either natural or artificial, usually will develop over weeks or even longer in order to be complete and perfectly responding to an antigen. So whenever a person will be exposed to a large dose of a very aggressive organism and doesn't have the established immunity, that puts them in great danger for developing the disease. In order to prevent the illness, the person may receive what is called counteracting antibodies, and those need to come from an outside source. We can do that by administering what is called an antiserum or an immune serum. And those will be this kind of pre-made, ready-made type of immunoglobulins that are effective against the organism that can be passed to that individual. And in addition to the vaccination, we can expect for them to be protected in the meantime until they will develop their own antibodies. Those type of antiserum this type of antiserum is usually prepared on animals, and mainly we are using horses because they are large animals and they are able to, with a nice immune response, that they are able to produce large quantities in antibodies. Once injected to a human, there may be some issues related to that because they are in fact foreign proteins. They are coming from an animal serum, and they may cause, in some cases, serious sensitivity or allergy reactions. There are some examples. We have an antiserum for diphtheria. We have tetanus, hepatitis B immunoglobulin. We'll have the Rh immunoglobulin, antivenins as anti-snakebite, botulism, and rabies. Which form of immunity results from vaccination? The options are A, natural active immunity, B, natural passive immunity, C, artificial active immunity, or D, artificial passive immunity. The form of immunity that results from a vaccination is the artificial active immunity. Immune disorders can result either from an overactivity of the immune system or from its underactivity. In the overactivity will be allergies and autoimmune conditions, while in the deficiency disorder we have the immunodeficiency immune deficiencies that can be congenital or acquired, like in HIV infection. In addition to that, we'll discuss also the another condition that is called multiple myeloma. An allergy is any type of exaggerated immune response that is a result of exposure to a substance or a protein or an antigen that is commonly encountered and in other conditions or for other individuals can be harmless. And as example of that, you know that allergy can happen to pollen or to exposure to shellfish. As a broad term that we are covering this whole category of conditions, we call them a hypersensitivity because there is an exaggerating immune response, and sometimes autoimmune diseases and transplantation responses are included in the same big category. Examples of typical allergens can be pollen or house dust, mites, animal dander. There can be drugs, as specifically aspirin, penicillin from the antibiotics. We can have food allergies, as allergies to milk, eggs, nuts. Also, some people may become allergic to insect bites. Inside this category, we have another reaction that is an exaggerated and severe life-threatening condition that is called an anaphylactic shock. In this reaction, the symptoms may occur extremely quick, from seconds to minutes after the contact, and will include everything that will be seen in other types of shock. Will be very low blood pressure with increased heart rate, swelling of the tissues and especially of the throat and the tongue, breathing problems, hives, and edema. The treatment needs to be prompt and is done by injecting epinephrine in addition to antihistaminic treatments, and in some cases we need to administer oxygen. For those patients that cannot avoid, the best treatment will be for allergies or hypersensitivity reaction will be to prevent completely the exposure to those allergens. However, not always that can be possible. And for those situations when the exposure to the allergen cannot be avoided, another treatment will be a desensitizing type of procedure when the allergic person will be exposed to consecutive and well-determined, increasingly in amount injections that will expose the person to the specific antigen in order to allow the body to accommodate to it. Autoimmunity refers to an abnormal response, hypersensitivity, that one will have to own tissues. In an autoimmune response, the body's own antigens will be seen as foreign, will not be recognized as itself, and as a result of that, the immune system will produce antibodies and will attack those cells. So in the factors that might result in autoimmunity will include the following. There may be a change in the self-proteins, those proteins that are coded as personal. And as a result of that, the structure will not be recognized as self. There may be a loss of immune system control, as it happens when the body is losing the control over the regulatory T cell activation. Or the antibodies developed against the pathogen will also cross-react and will recognize as non-self some of the body's antigens. So that is the typical example for that will be the rheumatoid arthritis or the rheumatoid fever, when the antibodies that are produced against the strep will attack the heart valves. Inside this autoimmune category of diseases, we have a very long list of diseases. We'll discuss that when we'll go through each and every single one of them in turn 2. what I can tell you right now is that autoimmune disease is 3 times more prevalent in women than in men, and probably this is related to the hormonal differences. In terms of treatments of autoimmune diseases, they all have some commonalities in the way that we are treating them. We'll use drugs that will suppress the immune system, such as corticoids, and we'll actually can use also anti-lymphocyte antibodies that are produced in artificially produced in lab, which is a chemotherapy type of treatment. Immune deficiency diseases are a result of a failure of one or more of the lines of defense of our immune system to perform when exposed to an antigen. Those immunodeficiency diseases can be congenital if they are present at birth, or they can be acquired. Also, they can be classified as transient. They can happen in some stages of our life, and after that, our immune system recovers as a result of stress or some non-specific viral infections, especially in young children. Also, there is a transient immunodeficiency disease immediately after birth, where the babies are born with a zero type of immune system. They do have the innate immune system, however, in the acquired one, the specific one is inexistent. What they have, they still carry the mother's antibodies that offer protection for the first couple of weeks. That's why it's essential to start the babies on a vaccination schedule as soon as possible in order to have them covered with their own antibodies as soon as possible. In the acquired immunodeficiency diseases, one well-known will be the autoimmune deficiency syndrome, or the acquired syndrome that is caused by the human immunodeficiency virus, HIV. In this type of condition, the HIV virus specifically attacks and destroys a type of T helper cells, the CD4 type, and as a result of a decrease in the number of those T cells that become inactivated, that interferes with the pretty much all aspects of the immune response, because the T helper, if you remember, those are the cells that are showing and exposing those are the cells that are exposing the antigens, and they are presenting them. And as a result of that, a wide range of infections or cancers can develop in those patients. In terms of treatments for this type of immunodeficiency, we can use those drugs that will stop the viral growth and replication of the virus, and they fall into the category of what is called the reverse transcriptase drug. Multiple myeloma is a very special type of bone marrow tumor that, as a result of malfunctioning at the level of the bone marrow, there is an overproduction of B lymphocytes. Very specific, the plasma cells become, they start malfunctioning. So the plasma cells will accumulate in the bone marrow and will interfere with the production of the normal cells, because they are multiplying so much, they are taking the place of other normal blood cells. And as a result of that, we see anemia and also a low resistance to infection, because those plasma cells are malfunctioning. They are very big and a lot of them, but they are not producing the correct amount or the correct quality of antibodies. They also, those plasma cells will produce a specific factor that will increase the bone resorption. And if you remember, because it's a bone marrow, it's at the level of the bones, and by increasing the bone resorption, that will lead to fractures, because the bone becomes extremely friable, and also to hypercalcemia. The treatment for multiple myeloma is chemotherapy and any kind of medication that can help to reduce the bone loss. The cancer cells that develop in our body will differ slightly from the normal body cells. And because it's usually one cell that it goes rogue, it starts to develop and hypertrophy and transform the tissue into hyperplastic tissue, and after that into a cancer type of tissue, they will start to be recognized by the body as non-self. There is a continuous production of so-called cancer cells. There will be cells in our body that continuously will try to become a cancer cell. But on the other hand, we have the system of non-killer T cells and the cytotoxic T cells that are extremely efficient, and they perform what is called immune surveillance. And once they are able to identify one of those cells, that is immediately destroyed. Now, this immune surveillance ability that our cells have when we are young starts to decline with age, like most of the process in our body. And as a result of that, at a certain point, one of those cells will become non-detected and will be able to transform into a cancer. Based on this capability of some of those cells of finding and destroying the cancer cells, there are some therapies that are in the category of immunotherapy for cancer. When we are trying to stimulate the patient's own immune system and produce a response from it that will eventually fight the cancer cells. And we do that by harvesting patient's T cell and activate them with interleukin and transferring back to the patients. And also, there are some vaccines that are prepared against specific cancer cells that are extracted from the tumor, from the patient's tumor. Another aspect that will involve the immune system will be encountered when we do a transplant and we talk about the rejection syndrome. So per definition, the transplantation is the transfer of an organ or a tissue from one organism, which is the donor, to another one, which becomes the recipient. And we do that to replace an injured or incompetent body part. And you have a long list of examples. We can transplant hearts and kidneys and liver and cornea, and we have transplant of bone, and different types of tissue will have different ability of provoking our autoimmune system. The more vascular that structure, the more metabolic active the transferred tissue or organ, the more it will produce a transplant and other will be recognized by the recipient side as non-self. In order to prevent what is called the rejection syndrome, that is a normal antigen antibody reaction that will be targeted against the transplanted organ or tissue, we have treatments to do that, and we do that by treating the transplant patient with immunosuppressive drugs that will keep the host, the recipient body at very low levels of immune response. As a result of that, the patient's ability to fight infection will be very, very low. Therefore, we are treating one condition, but we kind of expose the patients to other future issues.